All right, how's it going, ladies and gentlemen? Because some ladies could be watching this just because it's the men's health part two doesn't mean that someone's spouse or girlfriend, mom, sister, aunt couldn't take this information and maybe share it with someone who may be in need of it. So this is part two of the men's health, and we're going to talk about today below the belt, below the belt, and we talk about what that means for us. So I'm going to just dive right into it for those who weren't here last week. In the last session, I just kind of went over and touched over the basis of the top five things that will give us men the biggest health risk. Today, we're going to talk about below that belt in our part two segment. So hopefully I can help someone, at least provoke them to think about going to those appointments and meeting with that urologist. So we're going to dive right into it. Have you seen your urologist lately? Have you seen your urologist lately? So we all know that, yes, on one hand, the primary care is going to give us a lot of insight as to our overall health. Maybe there are some things that they can share with us about our main numbers, our blood pressure, our A1C, our cholesterol levels. And then there's other things that's in play, like our bladders, our prostate, things that are going to be below the belt, our libido, our libido. So we're going to dive into this, but having and seeing a urologist on a normal basis, at least on a regular basis for a checkup, especially when we hit a certain age limit, which we'll talk about, it's only going to help us lower our risk factors for a lot of those preventable diseases or things that could be caught early and managed very well. So check out your urologist, put them on the calendar, put them on your schedule, and make time to see them, especially if we're men, because there's a lot of things that happen with us as well as we mature in age that are just inevitable. But it doesn't have to be miserable. It's not our doom because we are aging. Okay, that's the idea of why you would want to see a neurologist. All right, neurologists focus on our urinary tract system, including our kidneys, ureters, our bladder, urethra, for men and for women. So just keep in mind that it's not just only one part that you would see your urologist, but it's multiple on multiple aspects. So if you're having any issues or if you have any questions, they are your go-to. He or she is your go-to person. Okay. If any of these sound familiar, go make that appointment. Not tomorrow, not next week. Make the appointment today. At least get the ball rolling. Urinary incontinence, weak pelvic floor muscles, erectile dysfunction, slow urine flow, difficulty starting urine stream, dribbling, not being able to completely empty your bladder. There's a host of other things, low libido, throbbing sensation in rectal or genital area. So all of these are telltale signs of why you would want to definitely go book your appointment with the urologist. These things we don't have to deal with on our own. Believe it or not, there are a host of other people who are going through the same symptoms, having the same signs. A lot of people go get help, or at least go get themselves checked out. Don't wait for your red flag and then your light to start blinking for you to check a lot of these things out. Having a regular checkup will help you stay abreast and stay in line with things that may happen, and maybe at least you'll be prepared for them to happen, if that makes sense. So because we're prepared, it will help us better program and plan we'll have a better game plan. This happens, then this would be the alternative. And then when we're getting our regular checkup, we know what to expect. Many times there are things that happen with us. We just think, oh, it's just women. They're the only ones that go through things as they mature. Well, it's also us as well as men. Our bodies change a lot because we're all humans. Our bodies change, and it's nothing to feel ashamed about. But it would be careless of us not to at least be in the know. We want to be in the know and really get ahead of the curve and just increase our quality of life. We don't have to have poor quality of life because we're going through these things. That's what our urologist for. We got to have a game plan, guys. By the age of 40, that is that number. By the age of 40, every man should have scheduled an appointment with a urologist. I am 37. No, I think I'm 36. So I have a couple years, but on the 40th birthday, yes, I will be going to check my urologist out every single year. And that's if I don't have any complications still. I don't have to have a complication to book and schedule that appointment. Why? Because it is necessary. Our bodies is going to be rapidly changing. So we want to be in the know. We don't want to have something to just catch us by surprise. So it's always better to know and at least be ahead of the curve. 40 at 40 years old, just think about it, guys. We are still relatively young, but also with age, in which men begin to feel some side effects of lifestyle choices that we've made. You know, we all get to decide, and we all get to choose how we're going to treat our bodies. Going to get our regular checkup is a necessary thing to treat our bodies well. We deserve it, right? So it should be something that we would want to invest in. Everyone will agree on self-preservation. This is one of those. This is one of those situations. So two of the top concerns at this point are prostate health. This could be an enlarged prostate, which could interfere with urination and causing frequent bathroom trips. So if this is you, maybe you urinate a little bit more frequently. These are all things that we should all be in tune and in line with. Knowing yourself, and I tell everyone that you know yourself better than anyone else. Maybe if you don't catch it, maybe your significant other catches it. Say, hey, you know what? You've been going to the bathroom a little bit more. Don't blow it off and say, oh no, it's just I've been drinking more water. So if it's a sign, then the chances are we should probably just err on the side of caution, that is, and just go get that checkup. Sexual function. This includes erectile dysfunction, declining in libido, preventing and treating sexually transmitted diseases. So, guys, your prostate and things that happen below the belt could interfere with those things. If you're feeling low in libido, what chances are there is something going on. We owe it to ourselves to check it out, see what is actually happening. Why is that? And that's better on both sides of the house. Not only should you know, but the other person on the other end, that's your partner, should also know as well. So just keep that in mind. This is just a small layout so of the anatomy of our prostate, where it is. So many of us, we're like, yeah, it's somewhere down there below the belt, but I don't know. So this is right here. This is that gland, the prostate. Back up a little bit here. There you go. The prostate is right dab smack in roughly about the middle of that picture here, or the illustration rather. And it's just below the urinary bladder, which is why when you have what we call enlarged prostate, which we'll get to, it will cause issues and complications within the bladder. Not only that, you have the rectum as well, which is why we talked about one of the symptoms could be pain in the rectum, because when the prostate grows, it produces a lot of pressure within that. So it's something to think about as well. See what else we have here. It can also push on the part of our tubing that will allow consistent flow, which would be our urethra. So those are things that you want to be very in tune, very in line with. So this is that illustration. So at least we know the anatomy and where it actually is. Okay. All right. In men, the prostate also functions as a reproductive organ, located deep within the pelvic region, muscular gland about the size and the shape of a walnut. At least that's how we start out. It sits right in front of the rectum, like we just mentioned, below the bladder and surrounds the urethra. It weighs about 20 to 30 grams, plays an important role, about an ounce, plays an important role in secreting prostate fluid, acts as a filter by removing any potential toxic substance that will prevent the sperm from doing its job. So it still goes hand in hand with our reproductive. So these are things that we want to protect. We want to ensure that all things are operating normal. Hey, a lot of people you have careers, and maybe you do want to have children even later. So maybe even at that 40-year-old, if you want to start that family, then guess what? These are things that you want to be in tune and in line with. Some of you are like, wait a minute, hold up, kids, 40, I'm done. Been there, got that, been there, done that, got the t-shirt, but you never know. Prostate growth. Here's the deal. When you're at birth, this thing is teeny, not even the size of a walnut. And then what happens is, as we hit puberty, it doubles in size, okay, to a size of an actual walnut. And then by the time we hit 25, that right now, it grows to the size of an apricot. By the time we are later in life and we mature, we're up in the 70s and the 80s, it could be the size of a lemon. It may seem scary, but that's just a fact and circle of life. So keeping that in mind, we know how to project what could happen. We expect what's going to happen. And again, a lot of the times with the prostate, it's inevitable. It's not that anything is wrong with the prostate. And from the research, we don't even know why that one gland will continue to grow in the nature that it does. But what we do know is that it does happen. So many times, and this is not prostate cancer. This is just enlarged prostate. This is just a circle of life. This is what happens. So knowing that could just help us on the front line for psychologically and just being a little bit more comfortable with what is to come. A lot of times we don't like to be blindsided. At least we're educated and informed. We're not kind of going crazy when these things do arise. So prostatitis would be your inflammation, which is a little bit different than the growth. Inflammation is say something is triggering this to be agitated, inflamed. So typically occurs due to bacteria and enter the prostate ducts and the rectum as a result of backward flow of infected urine. So this is not normal. This is not something that should happen. Like in a large prostate, we know it's going to grow over time. With prostatitis, it's a little bit different. This is not normal. This should not happen. This is when we go in and really be in tune with obviously getting our urologist on the phone or in contact with them to see what can be done. Right. So sometimes you can have asymptomatic inflammatory prostatitis, which means that prostate can still be infected and the cells are fighting and are present, but prostatitis symptoms are not known. So it's kind of, you don't feel it, but things are happening. So this is another reason why we go get the checkups, because many times we may not know what is happening. So because you're getting these constant checkups, you'll understand, okay, before this thing gets out of hand, before the situation gets out of hand, hey, at least I have some protocols and we're informed to know how to deal with it. So just keep that in mind. So now if you haven't caught the drip already, let's continue. If we're 40, we're coming up on our 40th birthday, and we are past 40. Let's take care of that prostate because it's super important. Quality of life we're talking about here. Benign prostate hyperplasia. This is a non-cancerous enlarged prostate. Okay, it's when the gland grows large enough to squeeze the urethra, which affects the flow of urine and causes other symptoms. So again, looking at the anatomy of prostate, if that gland grows so much, it'll press down on the main line, a tube rather, that directs urine flow. So that's why it's difficult to urinate. There's pain, backed up, and you can have infection because now you got a backflow because things aren't having a solid stream. So these are all things that become prevalent as we mature and as we age. Again, some things are just inevitable. So in fact, half of the men between the ages of 51 and 60 years old have it, and 90% of men over 80 have it. Guys, it's inevitable. We should be informed. We should know these things are going to happen. There are protocols intact to help us to increase our quality of life, and the urologist can help with that. That is the idea. We got this, guys. It's not linked to prostate cancer, nor does it increase your risk of developing it. Simply put, it's a fact of life. That's what it is. So not a matter of if, or a matter of when, but we're still not doomed. That's the message here. Okay. Yes, these things are happening. Yes, I can still go on with my quality of life. I need to go check in with the urologist to make my appointment and make sure that I'm still on cue. Things are being handled in appropriate time frame. It can be detected with a digital rectal exam. The old story, the old jokes. Oh, you're gonna go see you got the glove analogy, right? Let's go see the doctor. Stop. That's they have other means now. We're in 2022, so there's other ways to do things rather than manual, right? So which is nice. Maybe we'll get a little bit more people going in to check the urologist. I understand that that could be a no-go for a lot of people for a host of. I'm not here to judge, but there's other means and factors that they are using now that a lot less invasive. So there's that. Prostate cancer is uncontrolled growth. So now this is not a normal growth. This is uncontrolled growth. It just continues to grow and grow and grow. The second most common cancer found in men in the U.S. Pop quiz is the first one. What is the first one? Anybody know? If you watch the first one, it was lung cancer. So, but 1 in every 42 men will die from prostate cancer. But again, guys, this is not a doom and gloom. You do have options. However, most of the men will survive it due to its slow growing in nature. Right? Survival rate is significantly improved when you recognize the signs and symptoms, diagnose early, and receive treatment. We'll stop right there. Let's let that soak in. You don't have to die if you get your checkups and you catch it early. Why? Because this is very well studied, very well known about. There are protocols intact, and you could totally be in a safe zone if you are informed and have a nice team, but you will have a nice team of physicians. It's very well studied, and they're able to take care of you if this is the case, if it's caught early. It's not spread all over the face. It's not spreading to other organs, spreading to other tissues. That's why it's not the end of the road. Okay. Testing is crucial for diagnosis. Your doctor will review it, compare it to previous PSA readings. If PSA blood tests or digital rectal exams come back abnormal, your doctor may perform a prostate biopsy just to check the cell out to see what is going on within the cell. Is it cancerous? Is it not cancerous? And there's so much other research on that. If you just kind of go to the prostate research and cancer website, the website about prostate, they'll give you a whole host of the different levels and what they mean. But in a nutshell, no pun intended, if you are able to be abreast, be in line with your checkups, you catch it early, chances are your risk factors goes up for survival. And I'll just leave it like that. Right. So if any of the information you receive in the presentation concerns you, I really urge you to schedule an appointment with your primary care or urologist. Early detection is key. If you haven't figured that out already. You have control over your health. In our next session, we'll discuss some healthful lifestyle factors that can improve our quality of life as we age. So this was below the belt. These are some things that we can take with us and at least be informed. But now the next level, the next part of it is going to be, well, what do we go from here? What do we do? How do we lower our risk factors? How do we increase our quality of life? How do we keep our manlyhood, right? How do we do that? What tools are we going to use? That's what the next segment will be about. But I hope I was able to encourage everyone approaching 40, after 40. If you have the Manatee County insurance, please, guys, let's schedule our appointment with the urologist because it's only going to help us in the long run. I'm pretty sure whoever your people, the people who care for you most, they'd appreciate that long life that we can live, we can thrive, we don't just have to survive. So until I see you on the next one, my contact information is going to be on the county website. I'm also a registered dietitian and a personal trainer. You do get 5 free sessions with the trainer, and you also get 5 free sessions with the dietitian. So you get to choose how you're going to treat your body, and we can do this, guys. So I hope I was able to help someone with this information.